Hi, Dr. William Portuese from Seattle, and today we're going to talk about straightening the crooked nose with a closed rhinoplasty procedure. The crooked nose is usually caused from trauma. Trauma in some way, shape, or form, whether patients came out of the birth canal crooked, or they fell off their bike as a kid and don't remember it and the nose just grew crooked, or they got involved in a basketball injury or soccer, football injury, but the nose is crooked. The crooked nose itself is usually, there's three components, if you will, to the nose. First, you have on the top of the nose is the nasal bones. That's what gets fractured. The nasal bones become fractured and displaced, and we have to reset those in a more straighter and narrower position with osteotomies placed in those nasal bones. In the mid portion of the nose, that's more of a flexible cartilage called the upper lateral cartilages. And when you have a crooked nose, usually one side is concave and the other one is convex. So we'll have to add a spreader graft underneath the concave upper lateral cartilage to straighten the mid portion. If the nasal tip cartilages are crooked and asymmetric, then sometimes what we'll do is we'll take, if one side's a little higher, we'll take a little cartilage off of one side and add that cartilage to the lower side to balance out the nasal tip cartilages themselves. After a rhinoplasty surgery for the crooked nose, the cast is applied across the bridge of the nose while they're still awaking from the anesthetic. The cast itself stays on the bridge of the nose for about a week. Then it takes, several months for most of the swelling to subside. It can take 2 to 3, 4 months for most of the swelling to subside and go down. The visible bruising and swelling lasts approximately 2 weeks after the surgery, and then we ask patients to refrain from any exercise or contact sports for several weeks after the procedure. When I take the cast off, the first thing the patients notice is their nose is straight, and they're usually very, very happy. Even though it's swollen, you can see the new straight bridge line. It's impossible to straighten a crooked nose without a surgical intervention. The nasal bones are solid. It took a lot of force to break the nose and displace the nasal bones, and so the nasal bones have to be reset. You have to make little cuts in the nasal bones and reset them to a more straighter position, and then put a cast across them so that they heal in a straight position. Well, a crooked nose is cosmetically straightened with a rhinoplasty procedure. Rhinoplasty is cosmetic. If there's simply a breathing problem on the inside of the nose, way in the back of the nose, and patients are having difficulty breathing out of one side or the other, that can be what's called a deviated septum. The deviated septum is treated with a septoplasty if patients have failed medical management, and a septoplasty is done on the inside of the nose to remove a twisted or blocking piece of cartilage or bone that's blocking airflow through the nose. So that's done only for airflow dynamics improvement. So a septoplasty is only for airflow improvement, and a rhinoplasty is to straighten the crooked nose. Both surgeries can be performed together under one anesthetic with one recovery period.